This animation is a guide to help you use the Asept drainage kit. Depending on your prescription, you have been provided with a single 600 milliliter or 1000 milliliter bottle drainage kit. Please read and refer to the instructions for use included with every case of Asept drainage kits. Important product information. Before using this product, make sure you have been fully trained on the correct use of the items in this kit. If you have any questions or problems in regards to draining fluid, please contact your doctor or nurse. The drainage kit with drain line and procedure pack have been sterilized. These products are for single use only and not to be reused. Do not use if the packaging appears to be opened or compromised. Use a new kit instead. The Asept drainage kit comes with all the items you need to drain fluid from your drainage catheter. The Asept drainage kit either comes with a single 600 milliliter or 1000 milliliter drainage bottle and a procedure pack that contains all the dressing change items. The Asept drainage bottle contains a vacuum. The bottle kit comes with a green vacuum indicator plastic cap on each bottle, the drain line consisting of clear plastic tubing with pinch clamp, a green tube with a pinch clamp, the connector on the end of the drain line with a protective cap. Each procedure pack includes 2 pairs of gloves, 3 alcohol pads, 1 foam catheter pad, 6 gauze pads, the self-adhesive dressing, and a blue emergency slide clamp. Note, if for any reason your catheter gets punctured or cut, immediately clamp it off. Follow these directions. 1. Pinch the catheter closed between your fingers. 2. Push the blue emergency slide clamp that is included in the procedure pack over the catheter between the patient's body and the cut or leak. Push the catheter completely into the small end of the clamp. The clamp will close the catheter. 3. Contact your doctor or nurse immediately. Prepare for the drainage procedure. Locate a clean and uncluttered workspace to perform the drainage. Wash your hands with soap and water for at least 1 minute. Remove the adhesive dressing, gauze pads, and foam catheter pad from over your catheter. Check for any redness, tenderness, swelling, or fluid around the catheter. If you suspect an infection, do not continue with the drainage procedure and contact your doctor or nurse. Signs of infection include, but are not limited to, redness, tenderness, swelling, or fluid around the catheter. Be sure to receive training and answers to any questions you may have on the Asept drainage kit from your physician. Follow these step-by-step directions. You should drain fluid every 1 or 2 days or as directed by your doctor. Pick up the bag that contains the Asept drainage kit. Look at the green vacuum indicator on the top of the bottle. This indicator tells you if there is a vacuum in the bottle. The indicator should be down. During the drainage procedure, the vacuum indicator will expand upwards as the vacuum is depleted. If the green vacuum indicator is up, discard and use another Asept drainage kit. Peel open the drainage kit pouch all the way and remove the procedure pack. Leave the bottle on top of the pouch. Open the procedure pack by peeling the front and back of the pouch apart, starting at the top. Place the procedure pack on your workspace. Remove the tape and unfold the blue wrapping. Leave the enclosed items on the wrapping. These items and the inside of the wrapping are sterile. Don't touch them with your ungloved hands or other non-sterile items. Pick up one glove by the wrist and put it on. Pick up the other glove by the wrist and put it on the other hand. Both gloves fit either hand. Be careful not to let the outside of the gloves come in contact with anything non-sterile, for example clothing or skin. The outside of the gloves needs to remain sterile. Tear open the 3 alcohol pads, but do not remove the pads from the pouches. Place them on the blue wrapping. Remove the twist tie that holds together the drain line. Put the Asept bottle back on the open pouch. Do not remove the protective cap on the end of the drain line yet. Connect the drain line to the catheter. Squeeze the pinch clamp on the drain line completely closed. Hold the catheter valve in one hand and vigorously clean the valve surface and around the valve with one of the alcohol pads. Remove the protective cap from the connector on the drain line and align it in the center of the silicone valve surface. Push the connector into the silicone valve and twist firmly to connect. The connection must be tight to allow the flow of fluid. Draining fluid into the bottle. Release the white clamp until it no longer pinches the green tube closed. Release the pinch clamp on the drain line slowly to begin draining fluid. It is not uncommon to feel some pain or cough when draining fluid. Clamp the drain line to slow or stop the flow of fluid for a few minutes for symptom relief. If you don't feel better after doing this, stop the drainage procedure and contact your doctor or nurse. The fluid will flow into the vacuum bottles. If there is no or very little fluid flow, check and ensure that the connection between the connector and the valve is tight. Remove your gloves and discard. The drainage procedure will generally take 10 to 15 minutes. When the flow stops or the bottle kit appears to be nearly full, close the drain line by squeezing the pinch clamp completely closed. Disconnect the drain line from the valve. If you feel shortness of breath, or if the bottles appear to be filled with more than 2/3 of fluid, all the fluid may not have drained. Use a second bottle kit if advised by your physician to do so, or contact your doctor or nurse. Placing a new dressing. Put on the second pair of gloves included in the procedure pack. Pick up one glove by the wrist and put it on. Pick up the other glove by the wrist and put it on the other hand. Both gloves fit either hand. Be careful not to let the outside of the gloves come in contact with anything non-sterile, for example clothing or skin. Disinfect the area around the catheter exit site with the remaining 2 alcohol pads. Remove and discard the framed center panel of the self-adhesive dressing. Note, the framed center panel is on the opposite of the printed side. Put the dressing back on the blue wrapping. Place the foam catheter pad around the catheter. Curl the catheter around in a circle and place it on top of the foam pad. Be very careful not to kink the catheter. Place the gauze pads over the top of the catheter and hold them down. Peel the dressing from the printed paper backing, exposing the adhesive surface. View the area where the dressing is to be applied through the film and center the dressing over the wound. Press it down. Do not stretch the dressing during the application. Slowly remove the remaining paper frame by peeling it off on the split section while smoothing down the dressing edges. Once removed, smooth the entire dressing from the center toward the edges and firmly push down the dressing. Remove your gloves and discard. Emptying the Asept drainage bottle. Take a pair of scissors, cut off the green rubber tube connected to the drain line, as well as the vacuum indicator. Empty the bottle into the toilet. Discard the bottle.